Let's start with the first case. This was a previously healthy patient who presented with worsening bloody diarrhea and clear systemic inflammation. On endoscopy, you see severe left-sided colitis with deep ulceration. Now, even though the patient wasn't immunosuppressed, the severity and ulcer pattern raised suspicion for CMV. Biopsies confirmed CMV on immunohistochemistry with supportive blood PCR. Once antiviral treatment was started, the patient improved quite nicely. So the key message here is CMV is not limited to immunosuppressed patients. If the disease looks aggressive, it's worth considering. Moving on to case 2. This patient had known ulcerative colitis, but not on biologic therapy at the time. They developed a severe flare shortly after a recent infection. On endoscopy, this is quite striking: pancolitis with deep punched out ulceration. Although there was no active immunosuppression, the severity and appearances were concerning. CMV testing was performed, and both tissue testing and blood PCR came back positive. The patient improved with antiviral therapy alongside optimization of ulcerative colitis treatment. So again, absence of immunosuppression doesn't exclude CMV. In post-infective or unusually aggressive flares, it should definitely be considered. And finally, case 3. This patient had extensive ulcerative colitis and had recently been on corticosteroids. They were started on biologic therapy due to steroid refractory disease. However, quite early on, they re-presented with worsening symptoms. On repeat endoscopy, as you see here, there are no obvious deep ulcers, but the mucosa remains diffusely inflamed with loss of vascular pattern and ongoing active disease. Giving the clinical picture, steroid refractory disease with ongoing immunosuppression, CMV testing was essential. Biopsies confirmed CMV on immunohistochemistry, supported by PCR. After starting antiviral therapy, the patient improved and we were able to continue the biologic safely. This case highlights an important point. CMV does not always present with dramatic ulceration. Even when the endoscopy appearances looks more in keeping with typical inflammatory disease, CMV can be still present, particularly in refractory cases. So the key message here is don't rely on endoscopic appearances alone. If the clinical course is not behaving as expected, always think about CMV.